Hi, now I'm going to teach some advanced Mende how to take a medical history and perform physical examination. So first one, you want to ask about what is your name. So what is your name is Bile, Bile, or if you want to ask someone else what's the patient's name, what is his name, what is her name, you can say Gale, Gale. So after that, you will ask, how old are you? Or how old is he? How old is she? You can say bovui, bovui, or govui, govui. So after that, you can ask what happened. Be. What is be? Be. But you can also ask, what is your complaint? Or do you have any complaint? Complaint bilona. Complaint bilona. So usually they will say they have fever or they feel cold. So if you want to ask, do you have fever? You can say buluwe batigo, your body warm. Buluwe batigo. Buluwe is your body and batigo is hot. So batigo, hot. Or you can also say today the sun is very hot. You can say fui batigo, fui batigo. So fever is buluwe batigo. And then you can ask, how many days? Jilule. Jilule. Or how many weeks? You can say wikilule. Wikilule. Or you can also say how many months? Gavulule. Gavulule. So at last you can ask how many years? Fulule. Fulule. And then you can also ask, do you have cough? So you can say tohe. Tohe is cough. But if you want to ask, does he or she have cough? You can say alohelo. Alohelo. So after you cough, you want to ask, is there any sputum? So you can say avolo. Tohe avolo. And then you want to ask about the color of the sputum. So you can say ye kole yena. Tohe avolo ye kole yena. You can also give them some choices. So is it whitish? Whitish is quego. Quego. But they will usually say deep white. Deep white is quego fu. Quego fu. Or do you want to ask yellow? Is it yellow? So you can say bajigo. But usually some of them even doesn't know baji. Bajigo is yellow in Mende. So you can also ask yellow go, yellow go. Or even you can ask, is it like bloody or red? You can say tego, tego, tego. And then after you ask about the cough, you can ask, did you vomit? You can say babaleo, babaleo. Or you can also say, did she vomit? Or did he vomit? You can say alohelo, alohelo. And then if you want to ask, do you have diarrhea? You can say buku hunga boa, buku hunga boa. And if you want to ask constipation, you can ask, do you have constipation? You can say bugwe embego, bugwe embego. And then after that, if you want to ask any pain, you can ask gabago. Pain is gabago. If you have headache, you can ask buvui abale, buvui abale. But if you want to ask, do you have stomach pain? Is bugui abale, bugui abale. if you want to ask, do you feel dizzy? You can say, vui ngà bebe lo, vui ngà bebe lo. Or if you want to ask, do you feel shortness of breath? You can say, bale vua buha, bale vua buha. So after take a brief medical history, you will start doing the physical examination. So before you start, you can say, excuse me is cà phê vậy? Cà phê vậy? And then if you want to ask the patients to open their eyes, you can say, bia mi lau, bia mi lau. If you want to say, open your mouth, is bile lau, bile lau. If you want to ask him to close the mouth, you can ask them to bite. So bite is ni, ni. And then when you want to listen to the chest, you can ask them to take a deep breath and inhale and exhale. So inhale is levu, levu. But exhale is baya, baya. So if you want them to inhale and exhale, you can say levu baya, levu baya. And then after the history taking and physical examination, you will do the do some explanation. And then if you want to ask them, do you have any question, you can say moli bilo bella, moli bilo bella. And that's all.